And just noting that this meeting is being recorded, so if you please don't consent to being recorded at this time, you are asked to drop off the meeting before we get started. Okay, well, welcome everybody to today's webinar on healing and violence prevention in tribal communities. We're very excited to have you here and to have our panelists join us. Before we get started, just a couple notes of housekeeping. As mentioned, this meeting will be recorded and posted on the NIHB website. Please keep yourself on mute unless you're speaking, just to reduce any feedback or background noise. And feel free to place any questions you have in the chat box as we go. I wanted to share a brief overview of just today's presentation before I turn it over to our panelists. We'll talk a little bit about the origin of this webinar, and we'll hear from each of our panelists about their work and expertise, and we're very excited for that portion before moving on into a discussion. Before we get started, I wanted to ask if anybody wanted to offer a prayer to start us off in a good way before we go into this conversation. Okay. Today's webinar stems from a series of conversations that NIHB hosted last year with tribal public health practitioners, service providers, and other experts. The goals of those discussions were to strengthen understanding about current policies, practices, programs, and needs for violence prevention in tribal communities. One of the things we heard from that conversation was the need to focus on tribal ways of healing in order to prevent violence. Hence this webinar, where we hope to explore what healing looks like, what roles healing can play in preventing violence, and hear from our experts some examples of how healing has been incorporated into violence prevention programs in tribal communities. Just a brief note for those who may be unfamiliar with NIHB, we are an organization almost 50 years old, established by the tribes to advocate for the good health and wellness of all American Indian and Alaska Native tribes. Without further ado, I want to turn it over to our panelists, Dr. D. Bigfoot of the University of Oklahoma Health Sciences Center, Dr. Anthony Stately, the Native American Community Clinic, and James Leslie of the Navajo Division of Behavioral and Mental Health Services. They will each share a little bit more about their work and introduce themselves before we go into a discussion and some questions. So with that, I wanted to turn it over to Dr. D. Bigfoot to start us off.
Good morning. Thank you for the invitation. I'm going to share my screen and pull up my part of the presentation. I'm seeing, for some reason, it's not pulling up. Let me see if I share. Here we go. Did you give permission for me to share?
Yes, that should be there. Let me.
It's not pulling it up. I'm sorry. We had ran through this before. It was working.
No worries. If you want to email that to me, Dr. Bigfoot, I can show them.
Oh, you're asking me to do something that is, I barely can talk on the webinar, much less try to email something to you.
No worries.
Let me see. Let me try this again. Oh, here we go. Can you guys, is it on now?
Yes.
Great.
Yes, we can see that.
Okay, what I'm going to talk about is how ceremony teaches us to have the ability to center ourselves, to have the ability to have a way of grounding and a way of life that doesn't create contention and doesn't create conflict and doesn't create violence. So this is a pamphlet that I and my son Ahmed Sipes wrote for the Shoshone, the Shoshone Recovery Program in Wind River, Arizona, and they're going to be publishing this. I don't have copies to distribute, but would love to be able to share once those copies are up and ready for distribution. Okay, so I can see. Oh, so what I'm going to do is talk about make my introduction, the purpose of the booklet, how ceremony teaches self-regulation, the concept of self-regulation, and how ceremony prevents violence. So I'm of the Caddo Nation of Oklahoma. I'm very grateful for the Caddo people, and want to do the acknowledgement of that I am in Oklahoma. There are 38 federally recognized tribes in Oklahoma, and the Caddo Nation is one. And with the Wichita Nation was the original inhabitants of this area, the state we call Oklahoma. I want to say, as we think about this centering our cultural teachings, our ways of life, are the cultural teachings that allow us to be good relatives. This is really an important foundation piece. So certainly my foundation was in my Caddo ways, and I always want to be grateful to the Northern Cheyenne of Montana, because they have embraced and allowed me to utilize the things that I was taught as a mother to teach my children, to create that environment for them to know who they are as Cheyenne or Tatista people. And so they are enrolled at Northern Cheyenne, and very grateful for these teachings, because it has been these cultural-based teachings that allow for this centering and an understanding of how to utilize one sense of grounding in order to avoid conflict and avoid contention and avoid violence. So what I just in terms of setting the stage, is ceremony is not entertainment, rather it's a process for learning who you are, the process of self-discovery, this process of self-regulation, and really about sacrifice, being able to recognize the sacrifice of restricting how we think, restricting how we feel, restricting how we engage, restricting. I mean, a lot of times we think of ceremony in terms of sacrifice of food and water, but it really is thinking about a life of service. And so ceremony is about self-regulation that is a preventative and a centering way of life. So as we think about the various ways that ceremony comes into our lives, this morning we asked if there was a request for a prayer offering to start this off, and I think that that's a typical way that many of us start our day, start with a new event or transition to a new event, and that there's big ceremonies, but there are also very small ceremonies, such as the simple offering of water, or the few words to start something, or a song. And so a ceremony can be not something that is enormously involved, but it can be this steady daily effort that builds and helps ground an individual too. So as we think about it, and this is just as we think about the process for how do we want to eliminate violence in our homes, within our relationships, within our encounters with others, within our communities, and how do we want to start that healing process? Ceremony is about preparation, sacrifice, service, reflection, offerings, groundings that results in gaining that self-regulation. And self-regulation involves controlling one's behaviors, emotions, and thoughts in pursuit of either a short-term or a very long-term goal. More specifically, emotional self-regulation refers to the ability to manage disruptive emotions or whatever. It's not saying eliminate emotions, it says manage emotions. And the disruptive emotions are the ones that create conflict, that create that jealousy, greed, power, revenge, frustration, hurt. So how do we want to manage those kinds of things, those disruptive emotions, those behavioral impulses? And I think as you think about it, I'm a pretty impulsive person. And so kind of when something happens, I tend to just, want to go into that first impulse. But I think one of the things we learned from ceremony and understanding it as a self-regulation mechanism is that we stop, we pause, we think, and go through the various kinds of reactions that can be had, what we're going to say, what we're going to, react to, and choose the one that's the most beneficial. And I think many of you probably have been around your elders and others that just say, they're kind of very thoughtful about doing things. And so this, behavior impulses is putting that thoughtfulness right there. And then the actions, what is actually being done, and the intrusive or negative thinking, how do we manage what we see as unhelpful thoughts or inaccurate thoughts, or thoughts that keep coming back, creating a sort of a continuous flow of negativity in our heads. So this self-regulation, as we think about, it's an ongoing process that is practiced daily. It's really a daily grounding for improvement and mastery over time. So if you do it one day, then it's easier to do the next day and easier to do the next day. And for ceremony, there's preparation, which includes planning, scheduling, and thoughtful engagement with ceremonial individuals, families, or others that guide intent and actions. One instruction, there's many different instructions when we think about of ceremony, is that, that the instruction is think good thoughts in preparation to move into a ceremony. There was this young lady that was that was being treated for PTSD, and one of the things that she started doing as part of her therapeutic process in our TFCBT therapy session was beating. And she said, I realized I needed to have only good thoughts when I beaded, because I wanted to have the gifts that I was giving through my beadwork to be shared with good thoughts. So being able to bring these good thoughts to mind. So as we, think about this and how this self-regulation comes about, sacrifice is a significant aspect of ceremony. Not only in the preparation, but in the actual ceremony. It's common to refrain from food and water for a specific period of time. It also includes refraining from negative thinking, giving up bad habits such as that might be harmful long-term, such as alcohol, and eliminating comforts such as sleeping in a bed versus sleeping on the ground. So this is kind of the thing we think about in terms of sacrifice and in ceremony. And as we consider this, understanding of what is this portion of sacrificing and moving it to that next level, is that self-reflection. So it's this intense effort to be self-aware. And I think a lot of times, I mean, I'm guilty of this too. You know, somebody starts bringing up some kind of embarrassing moment or some kind of time that I wasn't my finest. And you know, I don't want to talk about it. I don't want that reminder, and you know, move the conversation to something else. But this opportunity for reflection is really important because it brings self-awareness and the willingness to accept feedback and instruction without being offended. Um, there's so many things that have not been right. You know, there's so much social injustice, so much disparities that exist. It's hard not to be offended. I mean, it's hard not to want some relief, some kind of acknowledgement of what has been so unfair. So I think it's how do we balance that? How do we balance this feedback and instruction that's personal with something that's affecting our whole community that has a negative outcome? So how do we, you know, accept this without being offended, without being reactionary or being hostile? And so as we overlay this ability to accept feedback and to not be triggered, it's this humility. Humility is a gift that is accepted in order for self-regulation to become more integrated and solidified. And so, you know, I think the gauge for certainly me is that if I recognize that I'm offended, that I have hostile or angry feelings, but I realize that humility isn't part of the gift that I'm practicing at that particular time. So as we, you know, think about how do we make this preparation? How do we think about ceremony in a daily lifestyle, a daily way of bringing our encounters with each other? And it's not being pious, it's not being, you know, overly moralistic, or it's not being, it's saying, you know, I have been given this gift, and how do I use it in the best way possible because I want to be that good relative. So that gift is how do we make these offerings? You know, we talk about gifts and offerings and prayers. And so here's the offerings that we can have is our thoughts, our behaviors, our words, our encounters. So, you know, typically we have a variety of offerings and the required preparation in terms of if they're not readily available, that is tangible offerings. And, you know, these offerings can be just as diverse as the many cultural teachings that drive gift giving. So as we think about those tangible offerings, we can also think about the offerings that we have in terms of how we think, how we feel, and how we engage with others. Oh, this is what I'm not being able to do. So let me go. I tried to get through this as fast as possible. Thank you. I hope that this generates some energy and excitement about how we can think about use of ceremony as we consider what is healing and what is violent prevention. And, you know, it's a philosophical way of thinking about ceremony, but I think it's also a practical way that we can utilize our cultural teachings. We can teach our children self-regulation. We can teach adolescents self-regulation. We can teach veterans self-regulation. You know, so and we can teach ourselves self-regulation. You know, at one time, it was quite common for our young women or our mothers to be to give birth without causing without uh, making a lot of noise. And that was one of the first teachings, is learning that self-regulation, that if, as you bring this infant into this world, that it's not being brought into this world through pain, but it's being brought into this world through self-regulation. And so as we think about that in terms of that preventative part, if we can recognize that by always being calm with our children, we give them a model for self-regulation. Thank you very much.
Thank you so much, Dr. Bigfoot, for that presentation and that great information. We'll have some time for discussion after, but we wanted to move to the next panelist. Dr. Stately, are you with us and connected?
Yep, I'm here.
Great.
Hi.
Would you like to?
Yes, I will. Thanks for that awesome presentation, Mom. A lot of people don't know that Dee is my adopted mother, so I should never go after her. Actually, I should know this by now. Don't go after her. I should go before her, because everything she does is so amazing and so profound that it makes me feel inadequate to follow her. But good afternoon, everyone. My name is Anthony Stately. I am the executive officer and the president of the Native American Community Clinic, which is a federally qualified community health, qualified healthcare center and a community health center in South Minneapolis, situated on the about a 7-block stretch of pavement called the American Indian Cultural Corridor, which is also home to probably the United States most densest urban population of American Indians in the country. So more Native people live in this 1 to 3 mile sort of radius of my clinic than urban natives than practically every other major city in the United States. Many of you, I kind of wanted to center my talks around my conversation about violence and violence prevention from the perspective not just of an individual level sort of intervention or a community level intervention. I wanted to talk a little bit about sort of like structural work. NAC has focused a lot of our work over the last number of years, specifically over within the sort of the area of trying to impact policy and impact the allocation of resources and a few other things. So I think arguably over the last 2 years, two and a half years, South Minneapolis, like much to the rest of the nation, has seen a significant growth in unsheltered homeless people. They've seen a significant growth in community level violence. We've seen a significant amount of attention paid to violence directed at our family members, our relatives, from police. Right, this is becoming a much more sort of prevalent sort of condition that we're seeing, are becoming more aware of. Perhaps I think it's likely a likely accurate comment for me to say that it's probably not that necessarily that we're seeing more of it, but it's just becoming more evident as we sort of become a little bit better at sort of paying attention and unearthing some of these activities. And then of course, the movement around missing and murdered Indigenous women and Two-Spirit people and has become a national, if not an international, sort of focus of many communities. These are direct results of the impact of colonization and the sort of like the living under post-colonial rule for the last several hundred years. And I think one of the things that I wanted to talk a little bit about from my perspective is that Well, my clinic focuses on delivering individual level intervention to people who are victims of crime. We have a victims of crime program. We serve a lot of people in the community who are homeless and who are, of course, victims of crime. They see a lot of victimization through their lived experience. We have in the South Minneapolis and in the state of Minnesota, we have the highest opiate overdose rates in the state in comparison to the rest of the state's population. Problem that has gotten substantially worse over the last 2 years since the beginning of the pandemic. While many of the other communities that we see impacted by opiate overuse or overdoses, both fatal and non-fatal, those rates have either remained relatively stable, and a couple of communities have seen small increases in those overdose rates. Native people have seen over the last 18 to 24 months have seen rates either double or triple. We talk about violence prevention. We don't often sort of think about the structural level things that contribute to our increased mortality and morbidity in our community. And these are certainly areas in which we need to sort of have a discussion about, like, the structures that are in place that contribute to such high health disparities and such high rates of mortality that are significantly greater than the rest of the population. And of course, you know, a very large contribution to that problem in our society is, you know, embedded within institutions such as incarceration, hospital, you know, healthcare institutions, educational institutions, those things that that consistently and continually fail our people. Those are important to be thinking about too when we talk about, you know, where are the opportunities for us to intervene in and prevent violence. So looking at structural racism and discrimination and those kinds of things that contribute to poorer health outcomes are really important. NAC does a lot of its work specifically around delivering services specifically to the unsheltered homeless population. In the state of Minnesota, 1 out of every 4 homeless people is Native American. We have one of the highest rates of unsheltered homeless people in our state and in our immediate region. And because of that situation, they are also more vulnerable to early death by either COVID or opiate use disorder or other injection drug use, and also, of course, through acts of physical violence. When individuals have to live outdoors in the middle of the winter and they have to live on, they have to sleep on in bus shelters, and they have to and light rail shelters, and they have to ride the light rail or the buses all night long so that they can have a safe place to sleep and stay warm. It also exposes them to other potential sources of violence, interpersonal violence as well. So there's a lot of work to be done in our communities around those specific conditions. One of the things that NAC has launched over the last 3 years in terms of our clinical programs and our community offerings is we put a lot of our own resources into building out the capacity to deliver cultural healing programs and interventions with our community. That really was born out of a couple of things that sort of became really evident to me early on in some of our work. In 2017, late 2017, early 2018, Justice, the Wall of Forgotten Natives was starting to sort of burgeon and become this very large event that we saw, not just here in Minneapolis, but I think it kind of got that specific condition got a lot of national and international attention. The Wall of Forgotten Natives was a homeless encampment that was situated about 4 blocks to the east of our clinic on Franklin Avenue, and about a 1 block length strip of grass that sort of like ran the span of like an off ramp of one of our local highways. And there was a point in time where there was close to 400 so odd folks living in that encampment in tents, with about maybe 400 people living in about 125 tents. And it became known as the Minnesota's largest homeless encampment in its entire state history. And during that period of time, there were a couple of deaths in that encampment, overdoses, but also some people who died of violence. And one of the biggest challenges that we had was how are we going to get, as winter was upon us, like in October and November-ish of that year, how are we going to get 400 and some odd people out of those tents and in safe shelter and homes, and get them off the streets and into spaces where they would be safe. NAC, along with about maybe 9 or 10 other community health partners, kind of came together in collaboration with the state, the county, and the city, and within and also with the Red Lake Nation, who offered a small amount of land that was really close to the encampment, a space and a place for us to put up a temporary navigation space that also included 2 or 3 large sprung structures that allowed us to shelter people for 3 or 4 months until through the winter. And what was amazing about that experience was that in a relatively short period of time, through very intense collaboration and through very intentional process, we were able to work collaboratively and house almost 95% of those individuals. And we look at some information now and data, and we know that 80% of those people that were housed in 2018 are still remain housed and have continued to remain housed. The bigger challenge is that we're seeing in other encampments, pop up again. And so one of the things that's become really clear to us is that, there's something structurally wrong with our society, because the 400 and some odd people that we housed before, the majority of them remain housed. And now we're seeing another 200 to 300 people living in encampments really close to our clinic. So there's something about the policies and the other things that sort of either create barriers or opportunities for people to get into stable housing that need to significantly change. And of course, we know things that one of the biggest challenges in that is that you are likely to not be able to get HUD housing if you have a history of some type of incarceration that usually involves violence or a gross misdemeanor at the minimum and a felony at the worst end. We also know that we live in a society that an unjust society that convicts Native Americans and Black and Indigenous people of color at a much higher rate than the white people. And so when we see these high unsheltered rates of people living and not being able to access and gain access to stable housing that was intended to be built and made affordable and accessible to them, and Native people can't benefit from that, we know that that's a direct result of policies that need to sort of change in both laws and also institutions that are gatekeepers for those services. So NAC is at the intersection of not just delivering healthcare services like primary care services and such. We're also working within large structures within the city, county, and the state to sort of create opportunities to change and challenge some of those policies that prevent our people from being able to live in stable and safe environments that that would keep them alive. So that's where we do a lot of our work at.
Thank you so much, Dr. Stately, for that information. We will now move on to James Leslie, our third panelist, to share a little bit more about his work.
All right. Thank you, Dr. Stately and Dr. Bigfoot. My name is James Leslie. I work for the Navajo Nation Department of Behavioral Mental Health Services out of the Fort Defiance office. I grew up in a little town called Houck, Arizona. Live in St. Michael's now. Well, what Dr. Stately and Dr. Bigfoot shared, that how you kind of get an idea of the dynamics of violence, and I think that's one of the biggest things to the biggest challenges. You know, it's usually not just the behavior and of violence, and you know, whether it be intimate partner, domestic violence, you know, emotional, mental abuse. At our clinic, we recently just added the mental health piece, you know, because of the dynamics of violence and substance use, and just about any kind of anything that brings us stress, you know, it usually includes some kind of mental health piece, and which basically dictates our behaviors. So I'm just going to share real quickly a couple of things. First of all, I'm going to share this little bit of what we're working with as far as the tribe is concerned. The Navajo Nation president, vice president, you know, they develop their priorities, and going down to behavioral mental health. These are some of the things that we're our initiatives that were handed down to us. And in there, you see domestic violence victims, emphasis on homeless and domestic violence victims, as well as addressing the support and policy for sexual assault and the missing and murdered persons, human trafficking. So, you know, that kind of gives us some direction as far as what we're doing. I think what Dr. Stately, one of the Dr. Stately mentioned was policy, you know, and I think that's probably the one of the biggest challenges in the work, since I've been doing this roughly about 10 years. Over the last 5 or 6 years, I've been involved with domestic violence prevention. Addressing violence is, you know, is such a huge task for any office in any tribe or community. So, you know, some of the things that we've tried, I think in the experience that I've had, a lot of it is hit and miss. You know, you're going to do some things that work, and some of the things that don't work. When it comes to policy, it can become a roadblock, especially when collaboration is in the things that you're trying to do. The integrated care between, you know, for us was the hospital, PD, EMS, probation, judicial. You know, we ran into so many roadblocks just because of policy, you know, the MOUs, MOAs that have to be in place. It's pretty simple, you know, coming from a clinical perspective of, you know, you want to help somebody, and you do the things that you feel should, or you have an idea of the things that you feel are going to benefit your community. But then you get hit with ethics and laws and rules, and it becomes a challenge. So, I think uh, at our office, one of the things that um, we've kind of pioneered, for behavioral health is we took on the Duluth model. That's the men's domestic violence program that we implemented pre-COVID. Since COVID has happened, and as you all know, it put a stop to a lot of things we were doing. Um, but with the domestic violence, with the Duluth model, it's a community approach model. So one of the things in there is it encourages meetings with local resources. And so back in 2016, we started a resource meeting with local resources, um, and it really snowballed. We were making real good progress up until COVID. Getting ideas of how we could address some of these things like policy, some of the, fill some of those cracks that not only abusers but victims and families were falling into. I think one of the biggest challenges that we have is sending individuals who are struggling with substance use or anger issues and batterers back to the environment they only know, back to their homes. So a lot of the initiatives that are set forth in within the Navajo Nation president um, uh, directives is trying to address all of this stuff from a holistic approach. I'm going to share one other thing. Let's see. I don't think I loaded it, so I'll just move on. So going back to prevention, behavioral health. We have the clinical, we have administration, we have prevention, and then we also have faith-based and traditional components. So we're structured to address a lot of these behavioral mental issues um, uh, effectively. We're effectively structured to do that. The part about it is, we, even though we're trained, we're educated, we're licensed, we all have our strengths as far as counseling is concerned. You can't force anybody to do what they're not, what they don't want to do. So, like the president had mentioned, when he does his talks, whether it be on the radio or in community, all of these behavioral mental health issues should be something that begins at the home. We should address them starting at the home. So that's one of the things that we promote. We the development. Of course, you got all your screening tools like ACEs and mental health screening forms, substance use screening forms, and you try to get a history and try to promote healing within the home. Like I mentioned before, one of the things we're trying to do is we're trying to reach families. We reach those people who are affected, whether it be significant others, spouses, children, aunts, uncles, grandparents. So each of our components have a specific role that they play. Prevention, you know, they do outreach, they do community stuff, they do Zoom presentations, radio announcements, radio appearances. They do, I mean, with pre-COVID, we were able to go to basketball games or chapter meetings and stuff like that. And, you know, just hand out information and really try to make awareness to the community. Now, most of the stuff we're doing now is virtual, you know, a lot of radio announcements and Zoom presentations. And if any of you are interested, we have a Facebook, the division of Behavioral Mental Health Services. Maybe some of you have seen our presentations, but we incorporate not only clinical but faith-based traditional teachings, some of the things that we feel that might help promote healing or positive development within the home. So going back to me as a clinician, as a counselor, I think a lot of it has to do with collaboration. Okay, the integrated care. Some of the referrals that we get, some of the referrals that we need to make, whether it be for inpatient, because we're primarily outpatient. We initially were substance abuse, but now we moved into mental health. But not only that, but with with law enforcement, with like I said, EMS, social services, probation, and just trying to develop a system that works. And for now, like I said, policy is a big challenge. And if I were to encourage any of you who are interested into in addressing violence, prevention, I would say start reaching out, get to know your community, get to know those resources, after school programs, shelters, anybody who might be able to assist or to make referrals. I think a lot of the children are victims who have no choice or who are just not sure where they can turn to. So we try to reach. We work with the local hospital pediatric unit. One of the nurses there, she's been very very interactive with us as far as giving us numbers, making suggestions. We still have people who are not on board with us completely. One of them is the school. There's a couple of schools that we've been invited for several years, and they'll attend one meeting, then we won't see them for a while. So a lot of this does take motivation and perseverance when it comes to addressing mental and behavioral mental health services. Educate yourself, continue to learn. Don't ever think you know everything. I think that's, for me, that's what keeps it fun. I go to other tribal websites to see what they're doing. I try to build a network. We invite anybody who wants to participate to our monthly meetings. We have monthly meetings on the second Tuesday of each month. If you are interested, just to see, some of the dialogue and what's going on. feel free to email me. I put it in the chat, my email address, and I can get you on we got just like a mass email we send out all the time, our every month invitation Zoom meeting. But yeah, I think for sure, if you're having problems with violence, and I'm sure every community is different, but stay motivated, be willing. People might break your heart and tell you no, but just stay persistent. And like I said, we've been doing this for about 5 or 6 years, and it doesn't get any easier. But I'm really enjoying what I'm doing. That's all I have. I do want to share one more thing, just to give you an idea of some of the things we do. Is this here is one of our resource documents. That this one's for Apache County. Okay, that's the county that we're located in. Like I said, we do our own research. We add numbers as we find them, or people reach out to us. And these are just some of the programs, their contact information that we do have. But there's also the stuff from we print these out, we hand them out. Some of them are local, some of them are national, statewide. Arizona Coalition to End Sexual Domestic Violence, we got their website. So this like I said, it if you get creative and kind of have fun with it, then it's really not work. But you deal with other offices, other programs, people, personalities, can get challenging. So I appreciate you letting me share. If you have any questions, my email's in the chat box, and I think that's it.
Thank you so much, James, for that. So now turning to some questions to all our panelists, and we are aiming to have some time too at the end of the session. So if anybody in the audience has questions, please feel free to put those in the chat box, and we will try and get to as many as we can. But a few questions for our panelists right now. The first was, we heard that Dr. Stately mentioned, healing, looking at the policy level and looking at structural causes of inequities. And James mentioned healing at the family level, really looking at interactions with the community. So I was wondering if our panelists could share a little bit more about ways in which programs may be structured differently, or different types, how you would go about incorporating healing at different levels across your programs.
Well, I think one of the things I would say about the structural level work that I do and that NAC does is it's healing, it's promoting healing for our community, but primarily through challenging systems and structures that are sort of rigid and haven't really thought about very strategically about like how they might think about supporting communities like ours that do the work differently, right? Like over the last 2 or 3 years, NAC has been fairly successful in doing things like challenging the state and also the legislature to fund some fairly quote unquote innovative work for them, right? And what I mean by that is like about 3 years ago in 2018, NACS launched a cultural healing program. We hired 2 elders and residents to start delivering cultural healing services to our patients. And that programming sort of expanded fairly rapidly, like it burgeoned really quickly. Our 2 elders and residents who are women who are both trained in sort of some Western healing processes, but they're also trained as Dakota and Ojibwe elders in some of their traditional healing ways, and they kind of integrate that into their work, but also integrate it across the clinic. But what we were able to do with that work was it laid the foundation for us to be able to begin to demonstrate some things for the state. That that particular model of care was a model of care that our community really had a deep desire and thirst for, and it had a significant reaction in being able to sort of do some things in our community. We were able to sort of leverage some of that work to actually get the state legislature to fund 5-year awards to all 11 tribes and to 2 urban sites to launch traditional healing programs that were sort of like pilot grants that would allow us to be able to see what would happen when we make a big investment in providing cultural healing services that were supported by legislative dollars to deliver in their communities. We also were able to do a number of other things. We were one of 5 grants that were awarded to throughout the state to look at non-narcotic pain management. And our specific grant looked at what happens when you position your non-narcotic pain management protocols and processes and program in a culturally centered model. So we use cultural healing modalities and married with things like mind-body medicine, so mindfulness and other ways of healing to promote and prevent. So to promote healing and prevent the use of narcotics and thereby reduce the impact of opiate use disorder in our community. And we just finished that project. It's about a 16-month project. We have a nice piece of work that we've developed, but it also has created the opportunity for us to do a fairly large, we're working now with Johns Hopkins University and some other evaluators on launching the HARA-1 that looks at culturally centered ways of preventing opiate use disorder, primarily utilizing those methodologies for managing pain. So I think part of it is like when you think about like, challenging structures, it's like, challenging them directly, like, let's look at practice-based evidence instead of evidence-based practices that have failed our communities for, decades. We've been using the methodologies and ceremonial practices that Dr. Bigfoot talked about. We've been using those since the beginning of time, tens of thousands of years, right? We know that those things work. And what I've done, I think fairly successfully within my state is to be able to challenge people who hold on to purse strings, right? And determine like who's going to fund what by being able to say to them, like, fund us to do what we know works because we've been doing it for 10,000 years. And get out of our way and give us the money to let us do the work and let us show you that we can make that effective.
I really appreciate what Dr. Staley said about practice-based evidence. I think that's sometimes you're gonna have to come out, you're gonna have to think outside the box. You're gonna have to do something that maybe like run with an idea. And it's a very different for individuals, communities, based on not only demographics, but what they're exposed to. There's some of the more frequent speaking Navajos will tell you the dialect's different from the Eastern Agency to the Western Agency. That it might be different when you apply some kind of culture-based treatment and education. So sometimes it's not about the evidence based. It's more about finding what works. And I think more is better. When I say more is better, is reach out, use all the resources you have available, whether it's in your office, whether it's in your community, whether it's within your tribe, or even in your state. Learn from each other programs, learn from other professionals, learn from the clients. Sometimes they they have a good insight when it comes to some of the things that need to be addressed. And don't be afraid to make a mistake, but you got to learn from it. Don't keep making it. Capitalize on it. And a lot of this stuff that we're doing over at our office is, we just keep rolling. We don't give up. We just keep there was a time when we had 50 people at our meeting, and now because of COVID and other factors, we're lucky if we get 10, but we stay consistent. We don't, we have our meetings, we keep going. So and then I know the one thing I didn't talk about was the traditional component. And that's huge in our area. It gets not only as far as the respect is concerned, but bringing like Dr. State was saying, bringing back the stuff that works, that worked for a long time. In Navajo, they call it the hojo, the good way of life, the beauty of life. And, but again, having that flexibility to incorporate it so, the younger generation understands. Challenging, but it can be done.
Well, I think, everything I learned that I know is not unique to me. I had amazing teachers in my life over the lifespan of my career as a psychologist and also as a community, a community activist. But one of my best teachers is my mother, Dolores Bigfoot. She's been doing culturally adapted and cultural programming for quite a while. That's actually, I think your intervention is in the SAMHSA compendium, they call it, of evidence-based interventions. And so I think talking with people about that project is really important. But I think it's also about recognizing I have a work at the intersection of both, Western medicine and also cultural healing. And one of the things I always have to talk to my community about is we are not a static culture. We've evolved and adapted over many, many millennia, right? Every single time somebody, we moved around the community, we moved around the country, we moved around this continent on Turtle Island and visited lots of places. And every time we went to a new community, we brought gifts and we borrowed gifts that they gave to us. And there was nothing different about that process also after a first contact. So we've always taken tools that other people have given us or given us opportunity to use, and we've adapted them specifically in the ways that were helpful for us. And I think that that same translation process has to be something that we continue to do today. We can take other tools and we can adapt them to be used in the ways that are important to us, not the ways that necessarily the colonizer or other people use those tools, right? And we have a lot of opportunity to do that with some really interesting things moving into the future, I think. But violence is not something that happens within our community in a vacuum. There are all these things that are connected to it, right? And a lot of those things are systemic.
Another question that I heard our panelists mention was that we know that the pandemic, the COVID-19 pandemic, has had far-reaching impacts on so many different areas of life. I'm curious just to hear your thoughts on, what are some of the ways in which COVID has impacted the ability to work on violence prevention efforts, to work on healing? What are maybe some, talking about, Dr. Staley just mentioned adaptations and ways in which things are changing, and what do you see are some needs or potentially new areas that might come out of the COVID-19 pandemic?
I think that the pandemic has done two things. One is that it has in very concrete terms, it has demonstrated a fundamental indigenous principle, the idea that we're all related. It has shown us in very concrete terms exactly fundamentally what that looks like. We are in the midst of a worldwide pandemic in which my ability to live and to live healthy is directly tied to the choices and the things that you do and the things that you make, and I mean, so others in our community, right? And so what it does is, fundamentally for me, it is a daily opportunity to remind me, like, of my original instructions as an Oneida and Ojibwe man. When I came to this earth, my original instructions from Creator are to sort of walk on this planet and walk on Turtle Island, and to sort of show up in every way, shape, and form that I can, as using the values that were embedded in our cultural teachings, and how to show up and be a good relative to everybody, right? And when we remember that, we can usually do some good work in our communities, right? And one of the things I think that's certainly a fundamental principle that it's taught us. It also has laid bare significantly in many ways just how disparate things are in our societies, right? And those are truths that cannot be challenged, right? The data is just significantly clear. And in my job and in my role, I use, I got the greatest job on the planet. I use white man's data to fight against them, right? So I'm showing them, like, your data says that you're unfair and unequal and inequitable in all these ways. And so I'm in those conversations, and I'm challenging them every single day. And I think those are really important things. I think one of the things that we will do also from the pandemic is we were forced to innovate. Like my clinic, we launched telehealth in like a week. And we had to sort of kind of think through like how we were going to do all this work differently, right? When in our traditional healing program, we had to sort of think through like, okay, like how are we going to implement traditional healing programming with our community when we can't sort of be face to face with them? So we developed a series of virtual workshops. We put together medicine kits and all these other kinds of things. We mailed them out to our patients. They joined our Zoom workshops, and they went through those processes and those things together in real time. And then we recorded every single one of those things and put them on a closed YouTube channel so that all of our patients can benefit from those things. And I think it just it made us think through like how we had to innovate so that we could actually do things, continue to provide services to our community, but also sort of like, do it in a way that was accessible and meaningful and important to them, and I think that within this pandemic, what it's taught us as Indigenous people is that, we are some of the first scientists on the planet. Like, we observed our surroundings. We used our intuition that Creator gave us, and we drew conclusions, and we tried things, and we are the original innovators on this planet. And so it taught us our innovative spirit, right? It reminded us of just how resilient and innovative we really are as people.
Yeah, I agree. I think with the pandemic, when it came on, we, areas of service that we were never thought of, like telehealth. We were forced to look into being different ways of how we were gonna still be providing services, and for everything from participation and motivation and inclusion. Not everybody bought into it, and I found, personally, I playing by the rules and getting vaccinated, whatever your program is calling for. You basically had to do it, or you know, you weren't going to be, I guess in a sense, it showed your level of motivation, and to do your job. And you know, it's been, you know, do I like getting shots? No, but you know, I'm going to do it if it can, if it's a requirement for me to provide services to the community. Even with masking up and hand sanitizer and all of these things, you know, like carrying it in your vehicles, and you know, you've got some 2 or 3 masks hanging on their signal lights, you know, and a bottle of sanitizer sitting in your vehicle or in your purse, you know. Those are the kind of adjustments that we had to make. And really, learning the computer and learning your phone, you know, it's I'm not to, I'm not, I hope I don't hurt anybody's feelings, but we've had some of the people who didn't want to do it. And even though I'm not the most tech savvy guy in the office, you know, I've forced myself to, you know, learn how to download an app, learn how to use an app. So these things, even with Zoom, so very challenging, but very workable and doable as long as you just take the time and learn how to figure it out.
Yeah, I agree. I think one of the things that I wanted to just quickly say in response to that question was that a couple things we learned also from the pandemic is that just how capable and amazing Native Indian health programming and services are across our great nation when we're given the resources to do the work that we know how to do. Like, we know our community best, right? And so all across the nation, what we saw is urban clinics and tribal clinics and tribally run health systems that were able to sort of get their communities vaccinated very rapidly, right? Many of our systems did a better job, as good of a job, if not better a job, as very large health systems, right? Early on in the pandemic, that was certainly the case. I think one of the things so what we learned from that experience was, like, when we were given the resources, meaning the human resources and the financial resources to do something, and we were also allowed to have the resources to do that, and the ability to do it in the way that was directed by our local communities, that we learned that those communities know their communities best, and they know how to deliver really good health services to them, right? And in fact, we did such a great job that many of those communities helped the surrounding communities, the counties around them, inoculate people when they weren't able to do it themselves. And so I think that we demonstrated also to the broader society our values as Indigenous people, that, you know, we are good relatives. We help not only just our own people, but we help all people. And so I think part of it is making sure that people understand that you know, that we're not asking for more than our fair share here. We're asking for the resources and the ability to do our work and to do it well for our community, and that we deserve those things. Those things are written into each and every sort of treaty, the right to health, welfare, and education, all these other kinds of things that will help us prosper as people. And we're just asking you to give us those resources and to let us do the work and get out of our way.
Thank you so much, Dr. Stately and Mr. Leslie, for that. I know we are just a little over time, so unfortunately we're going to have to end it here for today. There's so many more questions and conversations we could have, but I wanted to thank everybody for attending, and thank you to our panelists for joining. We really appreciate your time here today. Thank you so much. We hope everybody has a safe and happy week and celebrates. So take care.
Good to everyone. Have a good day.
Thank you.
Thank you.